Hi guys, so I wanted to give you all an update from yesterday, and I'm sorry if you can't really hear me because today is really rough pain wise. Ollie's hanging out with me in bed today. But like pelvic pain wise is just really bad, and I'm not really able to do much, so I figured I'd just be a good time to give you all an update and then also kind of an insight to what some of my moderate pain days are like. My severe ones, I'm usually like screaming or moaning really loud and throwing up a lot. So this isn't severe, this is more moderate pain. Because if it was severe, I couldn't film or talk at all. So, but anyway, I just wanted to kind of give you an update about yesterday with Dr. Theofilis with the Arilex Medical Center. He is one of the nicest doctors I have ever met, besides Dr. Sinerva with the Center of Endometriosis. Like, he was so nice. Like, he believed my issues, and he knew exactly what I was going through, and he believed me and validated what I was going through, and that was just huge to find that in a doctor. But it went really well. We got kind of a treatment plan idea. He agreed that surgery probably isn't the best call right now because of my adhesion related disorder, because every time I have surgery it increases my risks of adhesions to grow. He said if I ever have a point where I can't keep any food down, then we need to double check and make sure there's no obstruction caused by adhesions or any torsion. But as long as, and if that's the case, then we'd have to go into surgery. But as long as that's fine, then I shouldn't have to worry about surgery and trying to put that off as long as we can. Just not make the problem worse. And then, so what we're doing treatment-wise right now is, I'm on pain meds, 3 different types of options. So I have a muscle relaxer that is specific for this type of pain. I believe it's called Soma, S-O-M-A. And then that's twice a day as needed. And then I think it's Tramadol is the other one, or Toradol. I think it's Tramadol. And that one is, I think, 3 times a day as needed. And then the last one is the hydrocodone. So that's kind of my last resort, like when it gets really bad and I can't handle it, because I want to try to limit narcotic usage as much as possible because of the addiction risk and things like that. So we're going to try that, and then I also have a lot of like burning pain in my inner thighs, and he said that's from my incisions from my past surgeries. Basically, where they cut in the incisions for the surgeries is the exact place where that nerve runs for your inner thigh, and so that nerve has been damaged. So, what we're gonna do is, I'm gonna go down later and have, I think, like a nerve block or something done injection-wise. And hopefully that will stop the inner thigh burning, which would be fantastic. So, and a lot of it is trial and error. I'm also doing a ketamine compound cream suppository that should hopefully help. So, right now it's a lot of trial and error, but he is hopeful, and he said that he's going to be with me every step of the way, and he's not going to give up and not drop my case, which is a huge encouragement. And that he even recommended a doctor in Greenville, so that once we get a treatment plan working that works long term, I can continue it here in Greenville instead of having to go to Atlanta all the time. So that would be great. But he was so nice and listened and just answered all my questions and super sweet. And the nursing staff was super nice too. One of the things though I didn't know was I took Ollie with me. And I wasn't told beforehand that you can't have service animals in the back, because they do surgical things back there, like injections and epidurals and other stuff like that. So it has to be completely sterile. So it's not like against ADA or whatever. You just can't, because it has to remain a sterile area. So I didn't know about that. So my dad had to take Ollie back to the car, that's totally okay. I totally respect that and understand that. So just FYI, for those who are wanting to go there, just probably leave your service animal either in the lobby or don't bring them, because you aren't allowed to bring them back into the patient room. So, but he was super nice, and just having someone that actually believes you is so encouraging. But anyway, that's the update from there. And then hopefully I would love to go back to school, but that's a whole other thing. I'd like to go back to school next semester, but I don't know. So we'll have to wait and see how this goes. We also talked about like ketamine infusions and stuff like that, but he didn't really yes or no that. So, I don't know. We'll see. But I go back November 5th, to see what we're going to do, and then I think I'll also do the injection to try to get the nerve pain in my thighs taken care of. But anyway, until then, I'm just going to try to rest, and pray the meds work and can keep pain under control. He said we're probably, because I've had so many surgeries, we're probably never going to be able to get to zero pain. But we want to get it to where it's manageable and endurable, to where I'm not having to be in bed all the time or having to use my wheelchair all the time. I mean, granted, I use my wheelchair sometimes for my familial hemiplegic attacks, but specifically because I'm in pain, like not having to use that for pain. So, thank you all for praying and your sweet comments and encouragement. I really appreciate that. It means a lot. It's really encouraging and motivating, because when my pain gets really bad, I really struggle with getting down and getting depressed, and just because you see all your friends moving forward, and you see all your peers making more life decisions and getting to go forward in their lives, and I feel stuck sometimes. But I know that this is God's plan, and that He has a plan for me and a hope for the future. In Jeremiah 31:9, I believe. Don't quote me on that reference, but just remembering that God does have hope for me and a future plan for me, and I need to trust Him for that. So anyway, I wanted to give you guys an update and also kind of give you a little sneak peek into what it's like on a mild to moderate pain day. So I'm kind of just resting, watching movies, and then trying to get up every once in a while just to try to still be a little active and try and do some laundry, but not be able to do a whole bunch today. So anyway, I love you all, and I hope you stay chronically strong. Okay, bye.